Hello, this is Danita from Education Department, and in this segment, I'm going to do a little IView review with you. So if you haven't opened your patient's chart, go ahead and click on their name and open their chart. Again, just a reminder, when you get these pop-ups, you want to read them, and you're going to get them for several different reasons. These are called discern notifications, so always read them, and if there's any action that you need to take, make sure you do that right away. So let's go ahead and go into interactive view. And I just want to review a couple things that we learned in our live class, or you learned in a previous Fast Track Snagit module. So I want to go to Adult Systems Assessment. I'm going to do a little drag and drop here and kind of skinny this up a bit. And I'm going to skinny up my screen. Okay, so a couple things I want to go over with you real quick. Just as a reminder that anything in the navigator, so under Adult Systems Assessment here, if you can see my mouse moving, anything that is not highlighted. So for instance, if I scroll down, I will see that the fall risk scale, Henrik 2, is highlighted, and I can actually see that in my view window. Anything that is not highlighted is not going to show in my view window until I click on it. So I'm going to click on mental status, and now I can see that. Okay, so it's just a good rule of thumb that anything you're going to chart on after you do your assessment, just to go ahead and select those items. I'm just picking a few. Obviously, it's very specific to your patient, and for the most part, we do chart on everything. Okay, and once I've done that, I've got all these highlighted over here, my navigator. I'm going to go ahead and change my time to actual because that's how I prefer to chart it, and it'll actually clean up your screen for you a little bit. Then the other thing I'm going to do is, since maybe I've had a really crazy busy beginning of my shift and now I'm just sitting down to do some charting, I'm going to do an insert date and time. So I'm just going to right click on my time, insert date time, and then I'm just going to back this up to 8 o'clock this morning. Okay, and then if I double click the time, I can highlight my whole column and I can put checks in every section, and so then I can just start my charting. I'm going to hit tab to move down through. This is a really nice slick way to chart, and it really makes it a lot quicker for you. 16. I skip that one, go down to the monitored one. Don't forget you want to use those monitored fields because those are the ones that are tied to your medication. So I know I'm kind of whipping through this a little fast, just trying to get some. You just totally did the oximeter on this person's right foot. So I'm going to fix that by clicking on it and selecting left hand, which is what I meant to select. Okay. So I can just keep, I'm hitting tab on my computer, and I can just keep going all the way down my column. Okay, just throwing a few things in here. All right, and then I'm going to go ahead and sign, and that is how I need to do my back documenting. Okay, don't go back to a previous column. When we're in the hourly format, you know, it looks like I could just go back here and double click and start typing stuff in, which you can do that, but it's going to do a timestamp that you perform that at the top of the hour. So if I use this 5 to 5:59 a.m. column, it's going to timestamp everything for 5 a.m., which in most circumstances isn't usually a big deal, but if you have something go south with your patient, then you don't want 45 minutes between the time you had a blood pressure of 80/48 and the time that you actually documented that you notified the provider. So it's always best to use that insert date and time functionality. Okay. All right. So the other thing that I want to review here is adding things in. Don't forget you can customize your view. So right here on my screen is kind of towards the top of my list of things to chart on. There's a little icon. It looks like a pencil eraser over a graph. That is my customized view. So when I click on that, this is where I can add things in. So maybe for whatever reason, I'm doing an oral temperature. So I can put my little check in the box and I can hit OK. And under vital signs, I have now added the oral temperature field. going to go back to my Customize View icon. So the biggest reason for showing you this is that nurses are going to frequently need to use adding sections in. So if you have patients with a feeding tube, if you have a patient with a nasogastric tube in to suction, if they have an ostomy, you actually have to add those assessments in. Okay, so the best way to add an entire section is to hit this collapse all button at the bottom of that box. And then you can just kind of scroll through your list and locate, here's feeding tube. So the difference between the two columns, on view means I have to click it over in this navigator area like I did these other items for it to show in my profile window. Default open means I can just check that and it will be like my vital signs and my Henrik 2. It will already be there when I go in. Here's my gastric suction. There's my ostomy. So enema, if I have to scan a bladder, I got a bladder scan if my patient has a urostomy. So as you go down through, you'll see there's actually quite a few things that we can actually add in. So I'm going to hit OK. And now I will see those items over in my navigator. So here's my, where'd it go? Feeding tube, my gastric, my ostomy. Okay. So there's those items. The other thing I want to go back over with you is the dynamic groups. So nurses have to create dynamic groups on a regular basis. And a dynamic group basically just creates your label for your assessment. Okay, so an ostomy, for example. So I'm going to click on my little box here. And I just have to say, basically, I'm identifying the ostomy type, the status, the location, and the location description. Okay, so I'm going to say this is a colostomy. It's established. It's in their left upper quadrant. And it is more distal and okay. All right, so now I've actually created the assessment that I can chart the assessment of my ostomy, my patient's ostomy. Okay, so I'll do a double click here and let's see, maybe it's just a nice round stoma. And if we measured it, gosh, I haven't measured one forever, but let's throw an 8 centimeter in there. And stoma condition, hopefully it's hopefully pink, but we're going to call ours red. It's intact. Let's see, the pouch type. This is where we would do, like if they're using a wafer in a pouch or a closed system. So we could type that in. So it's already attached to the wafer. The part number, that's going to be located on their supplies in their room. The opening size, 1 3/4 inch. Okay, so you kind of get the idea here, right? So you have to add those items in. That's your dynamic groups. I'm going to go ahead and sign that. And then just the last reminder under intake and output. This is where you're going to be sure to document your intake, your IV fluids. If you're working in an area with iAware, that will actually pull that in for you. There's some steps that your preceptor will show you that how to do that. If you're somebody that's working night shift and maybe we're just sitting down at 8 o'clock to do our charting, you want to be sure that anything that went in or came out during your 12-hour shift or that 8-hour INO shift gets documented before this 24-hour total column here. Okay, so just kind of make sure that you're paying attention to that. So we can just click in there, and I'm gonna go down and do my urine output. Okay, and sign it, and then that will actually pull that into your 24-hour shift total. And the very last thing is the adult education. Don't forget to chart your adult education that you do throughout your shift. It is expectation that each nurse educates on 3 topics. And I've had people say, like, I'm not going to wake them up in the middle of the night to chart. However, you're always educating your patient. You just maybe don't think of it as a formal education setting. So if you're telling them about the medication they're taking, or you're reminding them to turn your call light on, why it's so important, you know, to prevent falls. All of that you can chart as your education. So there's a falls education here, okay? So I'm just going to chart, so verbalizes understanding, okay? Pain education, if they're having pain, you know, do they understand the difference between acute? Do they understand management of their pain? Okay, so those are our things, three of those topics. And I think that's all I have for you for the IView review. Again, if you have any questions, you can always contact me at extension 4029, or you can contact Miranda Anderson at extension 4028, or you can call Clinical Informatics at 4400 option 5. Thank you.